Hey guys, it's Simon Roos here from Fluid Physio and Gym. There's been a lot of talk in the media recently about lower back pain and the best interventions for lower back pain. And it's great to see that the medical world and the media at large now is looking away from surgery and away from drugs, especially opiates, and looking at the best outcomes for people with lower back pain. And that is essentially good exercise, and people are talking a lot about education and even psychological treatments. Now, I think we need to be really, really careful about the way that we talk about this. Back pain is a very real thing, and it exists on many levels for many different people. When we're talking about lower back pain, what we're saying is we know that an exercise and an education approach gives normally a better outcome than surgery or opioid medication. There are cases when surgery is critical and it needs to be done. We're not saying all surgery is bad, but we're saying that we really need to move away from being too keen to go in and do surgery for people with lower back pain. Because what we see is they get a better outcome from basically knowing how to move better and continuing moving. We don't want patients to have bed rest. We don't want patients to rush off for surgery. There needs to be a middle ground there. We're not saying that your back will be perfect if you've suffered a significant back injury. If you've suffered a minor injury, you can get a great outcome for your back. We need to understand that different injuries for the back can take different periods of time to heal. I'll often say you can have back pain for 6 days, 6 weeks, 6 months, sometimes up to 18 months. But your outcome can still be better than surgery if you manage it correctly. And that's where you can either have a go at managing it yourself, or you can speak to people who have done this with people for many years, and that would be your trusted physiotherapist or exercise physiologist. And what we help people with is to understand the exercise that best suits them. So there are particular exercises at particular stages of your lower back pain journey that can help. If you have just injured your lower back, then you might need more rest and more what we call load management, so less aggravation to your back. If you're further down the track and you've had back pain for 12 weeks, 6 months, 12 months, 5 years, then there's going to be specific exercises that will help, one, to relieve your back pain, but two, to have you function at a higher level so you can do more without risking stirring up your back. And a really important thing as well is knowing what activities will stir up your back. If you can identify what's going to aggravate your back and respect those things, you'll be more likely to care for your back better. So hey, look, if you've got back pain, or if you know someone who has back pain and you think they'd benefit from talking to one of us, please just private message us on Facebook. You can type in low back pain or please help with my low back pain and we'll get right back to you. Or you can look to book online through fluidphysio.com.au. Thanks for listening.